Well, many immigrants from countries affected by the Ebola crisis reside in the Washington, D.C. area, and they're concerned about their relatives in West Africa. However, misinformation and fear-mongering are making the situation even worse. To address those issues, the D.C. Mayor's Office on African Affairs, in conjunction with the Commission on African Affairs, has launched an initiative called Distinguishing Fact from Myth, Understanding Ebola, which targets the city's African residents. For more insight on the program, to commissioners from the D.C.'s Mayor's Office on African Affairs. With us today, Loide Jorge, who is an immigration lawyer, and Dr. Akua Asare specializes in psychiatry, health policy, global affairs. And I want to say, ladies, welcome to Africa 54.
Thank you.
Yes. Now, first, Dr. Asare, what are some of the most enduring misperceptions about Ebola, both in Africa and right now here in the United States?
That's a good question. One of the biggest issues we're having is people thinking that the West brought Ebola to the continent, that somehow organizations like Médecins Sans Frontières, the actual individuals that are coming in health care are actually the ones bringing the virus, which is an absolute lie. Another big issue is that there is medicine and there are drugs to cure Ebola here in the West, but that the people in the West are preventing people on the continent from getting it.
Okay, let me jump to you, Jorge or Loide. Let me say that.
Loide.
Good to see you after a long time. In terms of travel, most Africans quickly start panicking about the prospects of getting a visa to come to the United States. Should they be concerned?
Well, to be sure, there is no formal policy that's denying visas to applicants. However, there are extra measures that are being taken by the personnel at the consulates. For example, in Monrovia, there is a screening facility before you even enter into the consulate, so that they are sure that the individuals inside that are taking care of the applications and inquiries are protected themselves. In addition, if you are applying for visas, there already is a measure where you have to be tested by a designated physician who uses standards that were established by the Centers of Disease Control and the Health and Human Services to determine if you have a communicable disease, which includes Ebola.
Yes.
So if you don't have Ebola, the door is still open.
And so, in terms of those who are here and who may be desiring to go visit home, what should they be thinking about now?
Well, of course, first and foremost, their own health should be first and foremost. If they're concerned about the idea or the possibility of having issues re-entering, they should understand that those will only be issues if they are not able to pass through those screen checks, whether it be if they have to go back to the embassy to come into the United States, or the screen checks at the airports themselves.
Yeah.
Yes.
Okay, let's come back to you, Dr. Asare. So what is it that people need to know in terms of how this virus passes on from one person to another? We cannot overemphasize this. How do we help people really appreciate what it really takes for a person to get this disease?
The first thing that's really important is to understand that as long as we're afraid, it's going to spread. That we need to be educated. And education is available, CDC, WHO, everyone is putting out bulletins. There's information that exists out there. First and foremost, you cannot get Ebola from air or from water. It has to be direct contact from someone who is actively infectious. That means they're having symptoms at that time, or with bodily fluids, it actually is coming from them. So, or from something they can touch, like their clothing. We have to understand these things, and then things will be much better.
Okay. Now, Loide, there's a whole huge population of Africans in DC area, and as clearly indicated by the mayor's office, the steps being taken to address some of these issues. But have you really noticed or heard any kind of sense of panic in any way, or is it something you're just preparing for?
It's more panic for their loved ones at home. So if you're asking, are folks wondering, is there any danger of me catching it here in the United States? No. The majority of concern that we're hearing through the office and through our own personal vocations is our communities being concerned about proper information, protection, and safety guards not being readily available for their loved ones back home.
Mm-hmm. And so what can be done from here? What can you do here at the DC's mayor's office?
In protecting our
Yes.
our friends and family and loved ones, I think the key thing, as Dr. Asare pointed out, is education.
Mm-hmm.
Educating our loved ones. If perhaps they don't have access to the CDC or the WHO's information bulletins, but we do here.
Mm-hmm.
We all have access to the internet on our phones. Pick up the phone and tell your loved ones what they need to be aware of.
Okay. Now, Dr. Asare, just a little bit more on that initiative. How are you planning to, other than internet and any other web-based information, are there any programs perhaps where people will come together and be, maybe they want to ask specific questions and they'd be getting answers?
Right. Since this is something that's just kind of coming out, we are looking into any of those forums, community forums. We're also using this venue, such as VOA, to actually present the information. So not only are we looking at putting it out into the media, but we're also looking at discussing with different community-based organizations and bringing them into the picture as well.
And you cannot avoid suspicion all the time.
Yes.
Now, the gentleman in Texas died.
Yes, unfortunately.
And there's some on the continent who are saying, but all the other people who got Ebola and they were taken to America have survived.
Right.
So what do you think you can tell me?
Let's talk about time. Those 2 days that this gentleman was not taken care of, was not adequately treated, are of absolute importance. And I really believe that if we look at those 2 days, had he been treated earlier, this may not be the situation that we have right now.
So people shouldn't think, oh, maybe he wasn't given the proper medication because...
No, he was given appropriate medication. He's actually on medication that the individual, I believe in Nebraska or Kansas, is also on. Everything was done for him.
And what is your last word, Loide? Do you have any?
Information, knowledge is power. I think a lot of times we get consumed in the hysteria of fear, and that locks us into a space where we do not climb out and inform and be better. And so it's key that we keep our communities here and abroad informed.
What should you tell Americans who are interacting with people of African descent?
Don't be scared. Don't be afraid. That's it.
So fear both ways
Yes.
doesn't help anybody.
No, it doesn't.
Fear becomes a disease on its own.
Get educated.
Yeah, get educated. Thank you very much for
Thank you.
coming to our show today.
Thank you
and
so
sharing
much
that
for
information
inviting
with
us.
us. Okay. Well, Loide Jorge and Dr. Akua Asare are commissioners from the Washington, D.C. Mayor's Office on African Affairs. We want to know what you think about Africa 54 and the stories we covered during the conversation on Facebook. The address is Africa 54, and check out our headlines 24/7 on voaafrica.com.